At the end of the day, I know everyone's experience with dementia is unique, and there are these overlying factors. And interestingly, studies do show that if you do abuse things like alcohol, you are more likely to develop dementia. In his case, I know that he had a family history of dementia with his grandfather and mother, and all these factors together do put someone like David at risk. When you talk about dementia, can we just step back a little bit? Most people have heard about Alzheimer's, but dementia is an all-encompassing term in many ways. What exactly, when you're talking with a patient and you define dementia, what exactly are we talking about?
So dementia is, to put it simply, it's just a slow lack of the ability to think. The brain is basically divided into two parts. There's the cortical part called the gray matter, and then there's a deeper part, the white matter. And dementia is the loss of the cortical part. And the cortical part is where you think, talk, interact, you do a lot of executive functions, mathematics, and over time you lose this ability. So you see things in short-term memory loss, problem speaking, learn tasks like brushing your teeth, combing your hair over time.
And different causes, you know, with Alzheimer's, that slower progression, but there can also be causes like stroke that cause a more abrupt progression. Yes. But the one thing I think is important, because we always talk about when a celebrity comes out with a diagnosis, talking about what makes that diagnosis unique, because what happens in life is people will watch a celebrity and then they'll say, okay, well, that's what, for instance, dementia is. And we wanted to delve deeper because, you know, that is not a classic presentation where there are moments of just pure lucidity, disconnecting, erratic behavior. So I think it's important because we always say on the show, and Drew, I know this is something near and dear to your heart, that the initial symptoms can be so subtle. And the other thing that I found interesting was when David said he knew this was coming, most patients who are developing dementia don't really have insight towards it. Is that fair to say?
That's correct, yes. And even so, when you have a family history and you think that you're going to develop dementia or any other neurodegenerative disorder, the cognitive or the mental toughness you have to hold to know that you're going to develop this later on in life can also affect the way
Travis,
you look at life.
I mean, you alluded to it. Yeah, I went through this with my mother, the diagnosis of Alzheimer's, and you know, she was not really aware of what was going on. It was slow, it was insidious, and you know, I think she could sense it was scaring her that something was changing that was clearly out of control, but she would never come out and say, oh, I have dementia.
Well, and I think that our hearts go out to David, and my hope for him, I'm so glad that he's actually taking a step back from performing, focusing on his health, on our show, talking about how most important thing in his life was his son. And, you know, and this is an opportunity to talk about a really important illness that affects so many different people.